When it comes to men's health, there are few topics that carry as much quiet anxiety and confusion as the prostate. Tucked away deep inside the male pelvis, this small, walnut-sized gland has a disproportionate impact on a man's health, well-being, and even his sense of identity. It produces seminal fluid. It plays a role in sexual function, and unfortunately, it is also the source of some of the most common and serious conditions that men face as they age: benign prostatic hyperplasia, BPH, prostatitis, and prostate cancer. But despite how common prostate problems are, many men avoid the topic altogether until symptoms become impossible to ignore. By that time, opportunities for early diagnosis and intervention may already have been missed. That's why the question, "When should I get my prostate checked?" is not just a casual inquiry. It is a critical health decision that could mean the difference between reassurance and regret, between manageable treatment and life-altering consequences. To answer it thoroughly, one has to weave together medical science, epidemiology, risk factors, family history, cultural stigma, and personal health awareness. The prostate itself is deceptively modest in size, weighing only about 20 grams in young adulthood. Yet it grows with age, sometimes doubling or tripling in volume by the time a man reaches his 60s or 70s. This growth can cause urinary difficulties, slow stream, urgency, nocturia that affect quality of life. But more worrisome than benign enlargement is the possibility of malignant transformation. Prostate cancer is the most commonly diagnosed cancer among men in many countries, second only to skin cancers, and remains one of the leading causes of cancer death. However, the paradox is that many prostate cancers grow so slowly that they never threaten life expectancy, while others are aggressive and lethal if not caught early. This dual nature of prostate disease complicates the question of screening. Too little vigilance risks missing aggressive cancers, while too much screening risks overdiagnosis, overtreatment, and side effects that diminish life quality without extending life. It is against this backdrop that guidelines have evolved, suggesting specific ages, tests, and intervals for prostate evaluation. For most men, the concept of a prostate exam triggers thoughts of the digital rectal examination, DRE, an uncomfortable but quick procedure where a physician palpates the gland through the rectal wall to assess its size, texture, and presence of suspicious nodules. While the DRE remains a valuable tool, it is no longer the sole or even primary screening modality. The prostate-specific antigen, PSA blood test has transformed prostate screening since its introduction in the late 1980s. PSA is a protein produced by prostate cells. Elevated levels can signal cancer, but also benign enlargement or inflammation. The challenge lies in interpreting PSA results intelligently. A modest rise might mean nothing in one man and signal danger in another. Trends over time, age-adjusted ranges, and PSA velocity, the rate of increase, are often more meaningful than a single measurement. Today, many clinicians also employ adjunctive tools such as free-to-total PSA ratios, prostate MRI scans, or genetic tests to refine risk assessment. So, when should a man begin this journey of checking his prostate? The consensus varies slightly among medical organizations, but there is a general framework. For men at average risk, those without a family history of prostate cancer and who are not of African descent, discussions about PSA screening typically begin at age 50. The rationale is that before this age, the incidence of clinically significant prostate cancer is relatively low, and the harms of overdiagnosis outweigh the benefits. However, for men at higher risk, the calculus changes. African American men, for reasons that are not fully understood, but likely involve both genetics and healthcare disparities, have a significantly higher incidence of prostate cancer and are more likely to die from it. Similarly, men with a first-degree relative, a father, brother, or son, who was diagnosed with prostate cancer, particularly at a young age, face a doubled or tripled risk. For these groups, conversations about screening often begin at age 40 or 45. In rare cases of very strong family histories, especially those linked to BRCA1 or BRCA2 mutations, better known in the context of breast and ovarian cancers, some experts recommend even earlier consideration. Importantly, the decision to get screened is not a one-time choice, but an ongoing dialogue. A man who begins PSA testing at 50 and has normal results may repeat the test every 1 to 2 years, while someone with borderline elevations may be monitored more closely. Screening is not an all-or-nothing proposition. It is a continuum of vigilance tailored to individual risk and preferences, and it is not meant to continue indefinitely. Most guidelines suggest stopping routine screening around age 70 or 75, or when a man's life expectancy is less than 10 to 15 years, because at that point the harms of finding and treating indolent cancers usually outweigh the potential benefits. Still, not every prostate problem waits quietly for a scheduled screening. There are symptoms that should trigger immediate evaluation, regardless of age. Persistent difficulty urinating, blood in the urine or semen, unexplained pain in the pelvis or lower back, and sudden changes in urinary habits should never be ignored. While such symptoms are often caused by benign conditions, they can also herald aggressive cancers that require prompt attention. Too often, men dismiss these signs as just getting older, or feel embarrassed to discuss them with a doctor. This silence is dangerous. Open communication and timely medical evaluation can make all the difference. Beyond the purely medical aspects, cultural and psychological factors play a large role in when men choose to get checked. Masculinity norms sometimes discourage men from seeking help, as if acknowledging vulnerability were a weakness. The intimate nature of prostate exams also fuels avoidance. But shifting cultural narratives are helping. Celebrities and athletes who publicly share their prostate cancer diagnoses, awareness campaigns such as Movember, and a broader emphasis on men's preventive health are gradually destigmatizing the conversation. Encouraging men to see prostate checks not as a humiliating ordeal, but as a proactive act of strength for themselves and their families is a powerful motivator. From a public health perspective, the debate over universal versus targeted screening continues. Large trials in the United States and Europe have shown mixed results. Some demonstrate a reduction in prostate cancer mortality with regular PSA testing, while others highlight the problem of overdiagnosis. The U.S. Preventive Services Task Force, once firmly against routine PSA screening, now recommends individualized decision-making for men aged 55 to 69. This nuanced stance reflects the complex balance of risks and benefits. In practical terms, it means that men should not passively wait for their doctor to raise the subject. They should actively initiate conversations, armed with an understanding of their risk profile. One cannot ignore the broader lifestyle context either. While screening is essential, prevention and risk reduction are equally important. Diet, exercise, weight management, and avoidance of smoking all influence prostate health. Diets rich in vegetables, tomatoes, green tea, and omega-3 fatty acids may offer modest protection, while excessive red meat, dairy, and processed foods are linked to increased risk. Regular physical activity not only reduces cancer risk, but also helps manage benign prostate enlargement. Men who adopt a heart-healthy lifestyle often simultaneously support their prostate health, because the metabolic and hormonal pathways are deeply interconnected. Thus, the decision of when to get checked should be embedded within a larger framework of lifelong health maintenance. To truly grasp the importance of timing, consider the stories of individual men. A 52-year-old with no family history who undergoes a routine check and discovers a small, low-grade cancer may choose active surveillance, sparing himself unnecessary surgery while living with peace of mind. A 48-year-old African-American man who begins early screening might catch an aggressive cancer at a curable stage, altering his life trajectory. Conversely, a 72-year-old man with multiple health problems who undergoes aggressive testing and treatment for a slow-growing tumor may endure side effects, impotence, incontinence, without ever benefiting in terms of longevity. These scenarios underscore that timing is not only about age, but about context, risk, values, and goals. In recent years, advances in imaging and genomics are further reshaping the landscape. Multiparametric MRI can visualize suspicious prostate lesions with remarkable clarity, guiding biopsies more accurately and reducing unnecessary procedures. Genetic testing can reveal inherited mutations that dramatically elevate risk, prompting earlier and more frequent screening. Biomarkers beyond PSA are being investigated, such as PCA3 and the Prostate Health Index, offering hope for more precise risk stratification. As these technologies become mainstream, the answer to "when should I get checked" will become increasingly personalized. Ultimately, the central message is this: men should not wait until symptoms appear to think about their prostate. By then, the disease may be advanced, nor should they blindly undergo annual PSA tests without understanding the potential downsides. The right path lies in informed, individualized decision-making. A conversation with a healthcare provider, one that weighs personal risk factors, family history, ethnic background, and personal preferences, is the cornerstone. For some, that conversation begins at 40, for others, at 50, and for many, it continues for decades, adjusting as circumstances evolve. Screening is not a guarantee against disease, but it is a tool of empowerment, a way to tilt the odds in favor of early detection and better outcomes. So, when should you get your prostate checked? The honest answer is, sooner than you think if you are at high risk, certainly by midlife if you are average risk, and immediately if you have troubling symptoms. But more than just a calendar date, it is about cultivating a mindset of proactive health. Just as one schedules dental cleanings, cholesterol checks, or colonoscopies, the prostate deserves a place on the list of routine considerations. It is not merely about extending life, but about preserving its quality, protecting sexual function, urinary comfort, peace of mind, and the ability to live fully. The sooner men embrace this perspective, the more likely they are to face the future not with fear, but with confidence that they have taken the steps to guard one of the most vital aspects of their health. And that is the real lesson of prostate health. The right time to get checked is not only defined by your age, but by your willingness to take charge of your own well-being. To ask questions, to challenge stigma, to accept a little temporary discomfort in exchange for long-term reassurance. To recognize that health is not something that happens to us, but something we actively protect. If you are wondering whether it is time for you, chances are the answer is yes, because the act of wondering itself signals awareness, and awareness is the first step toward prevention, detection, and ultimately protection.